Hello, my name is Brent Fox. I'm a faculty member at Auburn University Harrison School of Pharmacy in Auburn, Alabama. I want to welcome you to this webinar entitled Pharmacy Informatics, Academia, and Student Opportunities. This webinar is being brought to you by the Professional Development Section Advisory Group within the section of Pharmacy Informatics and Technology. We're going to go ahead and jump right into the webinar. Our faculty today, in order, will be myself, and I'll be talking about academia experiences and opportunities related to informatics. Then we're going to hear from Dr. Kevin Fiji, and he's going to talk about his research activities. And then I'm pretty excited, we're going to hear from Ann No, a PharmD candidate, who's going to talk about her student experiences related to informatics. Our general overview for the entire webinar is or follows really closely with our presentation order that we just saw, in that we're going to first hear about opportunities in academia, then opportunities related specifically to research, and then we will talk about student activities and opportunities in this professional domain. So first, we'll begin with my portion of the webinar, Pharmacy Informatics Opportunities in Academia. This is myself, just a brief background. I completed all of my education, my formal education, here at Auburn. Again, it was in Auburn, Alabama, about an hour and a half from Atlanta, Georgia. I did spend about a year working for an EHR vendor between my PharmD and PhD training. And currently, I'm an associate professor. My department's formal name is Health Outcomes Research and Policy, and there you can see my email contact information. So the objectives for my portion of the webinar are to compare and contrast the foundational responsibilities of a faculty member, to describe informatics-related examples of those faculty responsibilities, and then to develop a plan to learn more about this particular professional domain. In academia, we like to talk about, at least here at Auburn, what we call the three-legged stool of faculty responsibilities, and those domains are listed on the screen or presented in this figure, and those are teaching, research, and then outreach. So the conceptual approach to this is that as a faculty member, you spend a portion of your time teaching, a portion conducting research, and then a portion conducting outreach. And as a faculty member, if any one of those legs of the stool is inadequate or is not fully matured, then the stool falls over and you have not achieved what you should as a member of academia, as a member of the faculty at any particular school or college of pharmacy. So we spend our professional experiences in these three domains. And there is a fourth one that some institutions like to talk about, and we certainly do that here, and that's service. So we distinguish service from outreach here at Auburn, at least. Service are those volunteer activities, and not always volunteer activities, that you participate in within your institution. These are committees and other activities such as advising student organizations. But we also conduct outreach, and that's where we work with professional organizations, such as being involved in this particular webinar. We'll talk more about teaching, research, and outreach in the subsequent slides. So teaching, as a faculty member, there really are two broad domains of teaching. You teach in the classroom, and you can teach in the experiential setting. So certainly pharmacy students are familiar with the classroom setting, and that may be a didactic experience, but it could also be some type of active learning experience where you're fully engaged with your faculty and your students. And then experiential is really the opportunity for students to have hands-on experience with patients, with resources and tools, and with other domains and facets of practice that will advance their education, ultimately hoping to enable them to be practice-ready graduates. So in general, those are the two large domains for teaching. And then you can further divide that into undergraduate teaching, professional level, which is the PharmD programs, of course, and then graduate level. So here at Auburn, pharmacy faculty members traditionally are not very involved with other undergraduate students, but we do have opportunities to bring them into our labs and our research programs when there's a good fit, and you have an undergraduate who's usually a little more mature, and they know exactly what they want to do with their future professional and even graduate work. So we certainly have had that happen here at Auburn with undergrads being involved in our research. Then, of course, we spend most of our time in professional education. And when we get down to the bullets below, we'll talk about what that looks like here at Auburn. But professional education is where, as an academic member of the faculty, you take your expertise, and in this case, of course, we're talking about informatics expertise, and you try to expand professional or PharmD students' knowledge of those particular areas. And then in graduate work, which is quite different really than professional work, graduate programs are very self-directed. And in those programs, students identify a mentor, an advisor that they work with to develop a research program. So here at Auburn, in my department, we're fortunate enough to have a graduate program. We have graduate students that focus on informatics activities. And then another consideration in teaching is that whether you're in a public institution or a private institution, there are some differences in expectations where you spend your time, if you will, for teaching, how much time you spend on research, and how much time you might spend on outreach. So there certainly are some consistencies in terms of the legs of the stool, but in public versus private institutions, you find some differences in where you're expected to spend more or less of your time. So here at Auburn, thinking about the professional program in informatics, even though we're undergoing a curricular revision at the moment, I'll talk about the way we have handled informatics in the past, and that is in our spring semester of our P2 course, which has a long name, but we just call it management. And we try to focus on topics in management that are not necessarily patient care or clinically oriented, but they focus on the context of healthcare. So certainly within the context of healthcare, we have informatics tools and resources that our students will use when they graduate. So I spend about a month, twice a week, talking about the various informatics tools that students will encounter when they get into practice. And that's within that management course. So that's a course that all of our PharmD students take, and they have taken for the last couple decades. It certainly has had different names over the years, but it's been around for quite some time. And then in the graduate level, I had the opportunity a few years ago to collaborate with computer science to develop an elective for pharmacy students and computer science students to focus on the development of mobile health applications. And that was a really exciting experience to see pharmacy students talking to computer science students, and they each have their specialty domains, but they each really had no real knowledge of the other's domain. So it was really exciting to see them collaborate to come up with solutions to specific problems that we gave them. And then the big problem with that course going forward has been that schedules simply don't match. And it's really hard to get that course to fill up because we can't get a time where everybody can attend. So that's been a real challenge as we try to address interprofessional education requirements for pharmacy school. And then the third experience where I have spent a lot of my time is in graduate education. So I have had and I have graduate students who focus on informatics topics. So a student I currently have is from Nigeria, and she's very interested in the adoption of electronic health records actually in her country. And it's been really fascinating to talk about some of the challenges they have there. And these are not challenges that you might think of here, such as having a consistent power supply. Something as simple as electricity is something they struggle with in other countries. So it's been really interesting to talk with her about her experiences and to follow her research. So speaking of research, Kevin's going to spend a lot of time talking about research, so I'm not going to spend a whole lot of time, but I thought there were a couple of points I wanted to make. The first is that the purpose of research, if we think about purely why faculty members and others do research, is because we want to advance knowledge and create new knowledge for society. And the purpose of that knowledge is to improve society's standing, if you will, or in our domain, to improve health-related outcomes or medication-related health outcomes using informatics tools. So there's a continuum of research. And by that, I mean there's a variety of methods. And the methods really vary, research methods really vary in terms of complexity. And related to how complex the methods are, you have more confidence and even more power, if you will, based on the different methods. So you learn more from different types of research methods. So these are things we have to think about when we're designing research projects related to informatics. And then there's a related field called program evaluation, and sometimes we see program evaluation activities um, being labeled research, but maybe they're not. So program evaluation is when we take research methods from the social sciences and then we apply those to the investigation of specific intervention programs. So the difference here between research and program evaluation is that in research we're trying to, as I said, create new knowledge for society. But program evaluation, even though it uses research methods, really what we're trying to do is evaluate a single program. And we often see that that's what we're doing with informatics projects, is trying to evaluate a particular program. So my research experiences really have focused on pharmacy informatics education. And by that, I mean trying to identify what has been and what should be taught in schools of pharmacy to prepare graduates to interact and utilize informatics tools when they graduate. And then another field that I find fascinating is trying to identify what actual factors might influence someone's use of technology. And that person can be a clinician or it can even be a patient. So what are the factors that influence use of technology? And then finally, something I've been involved with lately in regards to the opioid crisis that our country is facing are pharmacists and prescribers' usage of prescription drug monitoring programs. And that kind of relates to the second bullet in terms of what factors influence the use of these technologies. So these are just some of the things that I've been involved with. Again, Kevin's going to spend more time talking about research in general. So then outreach. This is when, as I mentioned earlier, as a faculty member, you provide service to groups or units, but they're external to the university. And this is really where you take your expertise and you collaborate with others, as I mentioned, that are not part of your university. So the involvement that all of us have with ASHP in the section of pharmacy informatics and technology, that's considered outreach. And there really are just numerous opportunities to get involved at the local, regional, state, and even international and national levels. So if you're someone who likes collaborating with others and learning new things that people are doing, then outreach is certainly something you would find exciting. The challenge with outreach is you have to be cautious in how much you commit, because as a faculty member, outreach often is not a large portion of your expectations for how you spend your time. So you don't want to commit too much and then not be able to work on the other things, such as teaching and research. Personally, I will say that outreach is very rewarding. I've spent quite a bit of time working with ASHP in this particular section, and it has been really fantastic experience. It's been very rewarding for me. I've learned so much from so many people, and it's been really a great experience. So as I mentioned, I've been involved with the section for some time. I'm also involved with the ASHP Research and Education Foundation, which is an entity a part of ASHP. Then also some other organizations that faculty members are usually involved with would be the American Association of Colleges of Pharmacy. And then some of us are also involved with the Pharmacy Health Information Technology Collaborative. Other organizations you might be involved with related to informatics would include HIMSS and then AMIA, and there are certainly others internationally as well. So we started talking about teaching, research, outreach, and service, and how those are the responsibilities of a faculty member. And one of the things that I really think is important to think about if you're considering academia is that everything you do in your teaching, your outreach, your research, they should all relate to each other and feed into each other. So, for example, I teach our informatics content here at Auburn. I conduct research on informatics topics, and then my outreach, as you can see or can hear, is with the ASHP section for pharmacy informatics and technology. I'm not involved with the other organizations that don't have an informatics focus, because that's a distraction, if you will. Certainly they're doing very important things, but it doesn't feed into my other experiences, and it doesn't draw from my other experiences. So that's one of the things that I think new faculty members struggle with, is making sure that their teaching and research and outreach activities all directly relate to each other. So ways to get started, certainly attending this webinar is a good start. For me, I had a mentor that I identified the first week of pharmacy school, and he was in my wedding, and he's still a close friend, so that's an important thing. Identify what other additional education and training related informatics you can access. There certainly is plenty through ASHP. And then spend some time with a faculty member or members and ask them and even shadow them, what does it really mean to be a faculty member? Because it can vary from school to school or college to college, and it can even vary within programs between departments. And then lastly, I would say certainly get involved with the section within ASHP. It's a very active section. It's a very important section, if I do say so, and they're doing really some fantastic work. So I'm going to transition over to Kevin now, and he's going to talk about his experiences with informatics research.
Thanks, Brent. I am Dr. Kevin Fuji. I am a pharmacy faculty member at the Creighton University School of Pharmacy and Health Professions in Omaha, Nebraska. And I'll talk just a little bit about my background now, although in a couple more slides, I'll talk a little more in depth about the specific research training that I received. So I graduated in 2007 from Creighton, and then right after that completed a health services research fellowship that had an emphasis on patient safety from 2007 to 2009, and then went back for a little bit more education and received my master's in educational psychology focused in research methods in 2013. And in my role here at Creighton, I also direct our Center for Health Services Research and Patient Safety. So my two big objectives for my portion of this webinar is to describe potential pathways for engaging in a career focused on health informatics research, and to identify examples of health informatics focused research projects. So as a pharmacy faculty member, I also engage in what Brent identified as kind of core activities of a pharmacy faculty member, but my position focus tends to be a little bit more on the research than the teaching, although to the point he made on that very last slide, my research and teaching are very much integrated as I teach elective courses in both health informatics and patient safety. And as I noted earlier, that also syncs up well with my fellowship training that had a patient safety emphasis. And that was when I was kind of first exposed to the idea of health informatics and the impact that health informatics could play on both healthcare in general and pharmacy practice specifically. And so to back up just a little bit more, I never really planned to go into research. When I was going through my PharmD program, I really thought that I was going to go into a career in an outpatient pharmacy and ambulatory care type of setting where I was helping patients manage their different chronic conditions. But during my last year, I participated in an elective research rotation that was focused on implementing enhanced communication to improve patient safety in an operating room environment. And I thought it was really interesting. I had never, again, considered a career in research before, but it was something that really piqued my interest and really shifted the way that I thought I was going to use my clinical expertise that I was gaining. As I said, ended up moving me into more of a research and a research fellowship type of career path. So during my fellowship, I actually served as a research coordinator on an Agency for Healthcare Research and Quality grant, which is a federal funding agency that funds a lot of health outcomes or health services related types of projects. And this grant focused on health information technology adoption and use by ambulatory care physicians in Nebraska, and then the type of impact that kind of adoption and use had on various aspects of safety and quality. And so I really started to think more about how was this impacting ambulatory care and impacting physicians, but what kind of impact could this have on the pharmacists who are also engaging with these technologies? And so I've completed a lot of kind of additional education almost on an as needed kind of basis to match projects that I've been working on. So I did health IT certifications. I have a CP HIMSS credential. When we're looking at different aspects of how EHR design and how EHR interface impacts different aspects of safety and quality, I decided to take an AMIA 10x10 course specifically on healthcare interface design that was offered by the University of Texas Health Science Center at Houston. And so I think it's a lot like the on-the-job training that a lot of pharmacy informaticists who are actually practitioners have received. I was also really fortunate from a research standpoint to be able to utilize my expertise and sit on an AHRQ healthcare research and training study section. So I actually utilized my health informatics expertise to review federal grants about different kinds of health information technologies and how they're being used to assess different aspects of safety and quality in practice. I've been fortunate to work with a really great interprofessional team. Research nowadays is rarely conducted alone. And so I've gained a lot from just being able to interact with colleagues in nursing, colleagues that have been trained in research and public health, other colleagues in pharmacy, and a colleague in physical therapy as well. And so that's been one of the other great benefits of research, is being able to engage with this interprofessional team. So health informatics in my research is focused on the perspective of how is health information technology used to support safe and high quality patient care, and how is health information technology used by patients to support their own self-care and self-management behaviors. And so a lot of my questions focus on health informatics more from a practice-based framework and not necessarily on those technical aspects of informatics. So for example, things related to data standards or things related to interoperability. And so I'll talk about two studies that I was involved in that were funded by a federal grant to really help illustrate just a couple of examples of my informatics-based research. So the first was a study that I did or I led about personal health record adoption by patients with type 2 diabetes. And so the study purpose was to explore the use of a standalone personal health record by patients with type 2 diabetes and assess the short-term impact of that use on both their hemoglobin A1C and changes in their diabetes self-management behaviors. And so the idea behind these types of personal health records was that if patients kept a better track of their health information, then that should in turn make them more knowledgeable about their health condition and how they're doing in self-managing their health condition. And it should provide them with then more knowledge about how to either maintain their health if they're doing a good job with their self-care and self-management, or how to seek out and then apply changes in behavior that could really improve their diabetes outcomes. And so we combined a randomized controlled trial with qualitative interviews to basically better understand how could a personal health record impact clinical outcomes of these patients. And so we had 117 participants complete the study. 61 were in the control group who received just their usual diabetes care, and 56 were in the intervention group who were trained on how to use this online standalone personal health record. We followed them for anywhere from 3 to 6 months. That kind of corresponded with their normal diabetes care visits. And then at the end, we also interviewed everybody who was in that intervention group so that we could better understand how did they engage with using this personal health record, what was useful to them about a tool like this, what wasn't useful to them about PHR use as well. And so you can see here that as you might expect from a kind of shorter term study, there weren't any significant changes in hemoglobin A1C from baseline to follow-up. And we also looked at 3 different measures of social cognitive concepts that we thought using a personal health record might lead to positive changes with. And so the first was modifying factors, which is basically different aspects of social support in diabetes education. We didn't see any changes over this 3 to 6 month period related to that concept. We also looked at self-efficacy, which was basically belief and confidence that actions that a person takes can actually improve their outcomes. And so, again, we didn't see any statistically significant differences in that self-efficacy from baseline to follow-up. And then finally, we assessed their diabetes knowledge. So did patients know what actual consequences of not maintaining control of their blood glucose would be? Did they understand that if they didn't do this over a long period of time, what those long-term consequences would be. And we actually did see a change in the intervention group from baseline to follow-up, indicating that those individuals displayed increased knowledge about both the short-term and long-term consequences of taking care of their diabetes and maintaining tight glucose control. And then when we interviewed those members of the intervention group, we found that personal health record users did find value in being able to self-manage their health information in this way. And so you can see representative quotes on the right-hand side of this table. So somebody said, I like that I can track my glucose level and I can see if what I've been doing and if food was causing me to have highs or lows. But we also found that few people use the personal health record more than once or twice. And so someone said that their A1C has been steady, so I didn't feel like I really needed to use it as often. That wasn't particularly useful for me. We found that PHR users were individuals who are already tracking their information, and you can see some were using things like Excel to be able to average and get their blood sugars, and that PHR users didn't proactively share their health information with their providers. There was a sense that the doctor already had all of their information, and that providers who knew that patients were trained in this personal health record use actually didn't solicit that information from their patients either. So despite having this mechanism, there wasn't any enhanced information sharing. And so this was an example of a study looking at how does implementing a health information technology tool from the patient perspective actually potentially impact their self-care behaviors and potentially in the longer run clinical outcomes. And so we did see, again, short-term increases in diabetes knowledge, but maybe some shortcomings on the use of the personal health record to actually facilitate more longer-term changes. The other study that I was involved in that I'll briefly talk about is one to do with the adoption and use of electronic health records, or EHRs. And the purpose was really to describe positive and negative safety and quality perceptions resulting from the use of EHRs with e-prescribing. And this was a survey study of rural ambulatory care clinics across Nebraska and Iowa. We surveyed 13 clinics with 425 different kinds of personnel. So it included everyone from physicians to pharmacists to nurses, medical assistants, support staff, etc. And it was an 87-item survey with dichotomous response options with statements like, our EHR has improved patient safety, or patients' medications are always in our EHR. And they were just asked to select yes or no in response to each of these statements. And we had an 83.3% response rate. And we found that the EHR and e-prescribing resulted in a perceived improvement in overall safety and quality of care. So a lot of the things that we've heard before related to e-prescribing in terms of enhancing legibility issues, in terms of being able to catch additional drug-drug interactions, and then from an EHR perspective, better access to patient health information and comprehensive patient health information. We also found that the EHR with e-prescribing use resulted in a lot of negative consequences with the potential to lead to workarounds. So people described a lot of problems with information being incorrect in the EHR, or information being missing in the EHR, or with e-prescribing transmitting incorrect information on the e-prescription itself. And that these workarounds actually negated some of the benefits of the EHR with e-prescribing and then introduced additional opportunities for errors to occur. And so one of the examples was when people struggled with using the e-prescribing system, they sometimes just ended up bypassing it, and instead they telephoned prescriptions over to the pharmacy, which was fine, but it kind of eliminated the benefits of the e-prescribing system in the first place, and it reintroduced problems such as not being able to hear the other person over the telephone and transcribing the prescription incorrectly. And so our big takeaways from this study were that there was a disconnect between the proposed benefits of EHRs and e-prescribing use compared to the actual functionalities available, and then trying to integrate it within the patient care workflow still hadn't been completely optimized in a lot of these clinics. And so there was a sense that the EHR could do a lot more things than it actually could. There was a sense that it was interoperable or could exchange information with a lot of different outside providers, and that wasn't always necessarily true depending on the system that was being used. And so we kind of came to the conclusion that all EHR and e-prescribing users have to be aware of these limitations that have the potential to negatively impact quality and safety of care. And so there's a lot of things that these technologies do well. There's a lot of ways that these technologies do improve safety and quality, but they also introduce a lot of unintended consequences that people have to really be educated about and really take into account when they're using these kinds of technologies. And so strategies have to be developed to address limitations, prevent workarounds, and maximize those functions which can enhance safety and quality and kind of and also minimize those functions or those features that have the potential to negatively impact safety and quality. And so these are just two examples, again, of more practice-based types of research. I don't know, sometimes people think about health informatics and they think of it from a more technical perspective, but that doesn't necessarily have to be the case. And so in addition to these two studies, if anyone's curious about other kinds of practice-based health informatics work, here's some different things that I've been involved in that you're welcome to go ahead and kind of take a look at. So ways to get started. Just like Brent, I've identified a few ways to learn more about, in this case, a research career pathway that's focused on informatics that I think have really benefited me over time. And so my first bullet here is seek out a research mentor. Just like Brent said, you know, I think this bullet could even really say seek out mentors broadly, including ones in research. And so these are the individuals whose work you admire or who are in positions that you strive to be in the future. They can help you get acclimated to research, provide you with opportunities to engage in different projects, and overall, I think just be a good resource for you as you move through your education. I have a lot of mentors, some that are focused more on research, some that are more informatics-based, some that are more practice-based, and even some just in the leadership area, and they continue to help me grow as well. The second suggestion I have is to take advantage of a variety of research training opportunities. So this could be an independent study with one of those mentors you're working with. It could be an elective course in research, or maybe even a research-focused API. Or maybe your school or college has student research programs that you could engage in. And the point, I think, is just to get some early exposure to what research is and how researchers go about addressing problems that involve the use of health informatics. My third suggestion is to not limit yourself to just informatics-based research. So this could ultimately be the area that you're interested in, but I think gaining any kind of experience is highly valuable. And that kind of leads me to my last suggestion, which is think about how research could inform your practice or future practice. And I think one of the really fun parts of research is discovering how so many problems are interrelated. And so you could start with a general pharmacy practice problem and discover that maybe one of the potential solutions is informatics-based. And so your project morphs into figuring out how a certain piece of technology could be integrated into the clinical workflow to solve your problem. And so I'd say think big picture, don't limit yourself. Think about how informatics might intersect with other practice areas that you might be involved in. And I think just in general, the more experience you get, the more opportunities you'll open yourself up to in the future. And so with that, I'm going to turn it over to Anne, who's going to talk about student opportunities.
Thank you, Kevin, for that introduction. My name is Anne. I'll be talking about student opportunities in pharmacy informatics. I really did appreciate how both Brent and Kevin's concluding slides really just outline what I'll be going into in detail. So I'll start off with the background of myself and talk about how I got into informatics. I'm currently a student at the University of Iowa College of Pharmacy. I also am working at the University of Iowa Healthcare, which is fortunately just across the parking lot from the College of Pharmacy as well. During pharmacy school, I did complete a Master's of Science in Informatics. I started this about my P1 year and finished it about my P3 year. And so it's very much possible to do this during pharmacy school. And then as well, I want to talk about my undergraduate career, where I actually did a bachelor's in biochemistry. And it wasn't until about late in my undergraduate career, after I had already applied to pharmacy school, I hadn't interviewed yet. This was early during my senior year. I had realized that informatics existed as a field. I actually knew what informatics was. I didn't quite know exactly what it entailed, though. And what I had realized during some of my undergraduate research for a biochemistry lab that was a computational biochemistry lab was that I was only a few classes away from a minor in informatics, because earlier in my freshman, sophomore years, I had taken some electives in data management and computer science, and merging those fields together, you kind of get informatics, which I'll talk about in a second. And then as well, there's my current contact information. So here are my objectives for my section: to identify opportunities to partake in job shadowing research and other special projects related to pharmacy informatics. And then secondly, to recognize potential barriers in establishing both didactic and experiential education in pharmacy informatics, such as dual degree programs, graduate certificates, and also IPs and AITs. So here's an outline of what I'll talk about. I'll start with job shadowing and research and special projects that are more practice related. I'll go into how to get involved professionally, and then lastly, how to take advantage of academic opportunities, whether that be through dual degree programs or during your introductory pharmacy professional experience in your rotations as well. So first and foremost is to network early. I can't stress how important it is that the earlier the better. I know there are some arguments saying that, you know, during your first few years of pharmacy school, you want to focus on your classwork and your schooling, but I'd actually argue that the earlier you start networking, the more time you give yourself to create those opportunities. A lot of times networking is kind of a ripple effect where, you know, you meet one person and that causes this person to introduce you to another person, and with multiple cause and effect relationships, that takes time. So the earlier you can get started, the better. So just like both Kevin and Brent mentioned, to identify a mentor, I would say definitely try to find someone either directly in the pharmacy informatics field or not necessarily in the informatics field. So luckily, both Kevin and Brent are faculty members of their colleges of pharmacy, but that's not necessarily the case all the time. I would really encourage you to reach out to somebody that isn't necessarily on your faculty list, someone who doesn't teach any lectures at all. And this might mean that you have to network early, talk to someone who isn't in pharmacy informatics, and they might know someone who works in a pharmacy informatics field. Just ask them, see what it's like to spend a day in their shoes. And then as well, if there isn't any current pharmacists or pharmacy researchers in informatics, you can reach out to medical and nursing informatics as well, because a lot of times informatics is a multidisciplinary field, and they can also provide a lot of insight into what you could do as a future pharmacist. I would also encourage to ask everyone about their career pathway and how they got into informatics. I say this because pharmacy informatics is a fairly new field, and a lot of times the current people who are working on pharmacy informatics jobs, they don't have formal training in informatics, and that's probably because nothing existed when they were in school. So definitely ask them how they got started, and it really can paint a picture of what the true problems and the true opportunities are in informatics. So as well, their job titles may not have informatics or technology explicitly in their position. They might just do something maybe in the afternoons, or maybe they are informally in charge of this certain project that has to do with informatics. And then as well, some terminology that you might want to look out for would be just information systems or data analysts. I would also, when you're talking to these individuals, inquire about any projects that you can help out with. A lot of times this isn't necessarily a black and white answer, and it might not be a straightforward opportunity, but if you keep on asking about what they do and what current problems they're having, you will definitely identify something that you can help out with, because a lot of times hands-on experience goes a long way. A lot of times working directly with these projects will give you a lot of insight that you can't get from just talking to someone. And then as well, talk about specific examples of research and special projects that you can partake in, the first of which could be either academic or practice related. So it may be outside of the pharmacy field. So maybe this particular person or this particular researcher is actually a PhD or an MD. As well, you can look into health information exchange as well to see what people are doing at other practices. Sometimes these projects have to do with improvements in the electronic medical record or electronic health record. For instance, this could be as simple as, what happens if we add this button to this page? Does it change how providers prescribe this certain drug? Or if there's an alert that comes up for a certain drug that might be way too expensive for this particular situation. It could also be as non-clinical as how helpful is it to have patient pictures and profile headers. And then as well, it could be financially related, where there are a lot of technology ideas out there right now, and a lot of startup companies, and they're trying to get their foot in the door into having their technology used in health systems, and sometimes that requires some financial analysis of whether investing into that technology is worth it or not for that particular institution. As well, it could also just be quality assurance on a new technology that you have just implemented. So maybe analyzing data on a new infusion pump that your institution just bought that has these new technologies or these new features of it, and how that has impacted the practice. And then as well, I'd caution that there is a lot of concepts and project management involved with this, because a lot of times with new technology, that a lot of times the project management team is involved in implementing these. Further, data management is also a very, very good skill to have in the informatics world. Some things that you might look out for would be SQL, SAS, R, and Tableau. These are all data management tools. Even if you could take an elective, or maybe there's a one-time afternoon seminar on it, I would definitely get as much exposure as you can to these skills, because they will be very invaluable to you and to get under your application as well. And then I would definitely get used to Microsoft Excel pivot tables. I'll personally say that a lot of times during my job during my data processing job, 9% of the time I am making pivot tables. I love pivot tables, and they can uncover a lot of information in certain projects when you are analyzing data. As well, if you can get into the opportunity of using Microsoft Access, specifically the queries, and maybe even changing some of the SQL behind these queries, that will also be very helpful in understanding how data management can affect pharmacy informatics. Like I said earlier, with financial analysts, it can also be, for instance, with 340B pricing. A lot of times you'll be looking at data with drugs, and they need this set of drugs, the 340B drugs, to be separate from the non-340B drugs, and how that plays out, and if that matches what they intend or not. And then as well, 80-20 reports, where a lot of times 80% of the problem is really only because of 20% of the content. And a lot of times financial analyst reports will create these 80-20 reports that you can look at and manage and trend over time. Other projects that you can look at would be telepharmacy. That's a fairly new field as well. And for instance, this could mean using video conferencing for prescription consultations. And so, me being from Iowa, there are a lot of opportunities where those small town pharmacies are closing down, and there isn't a pharmacist in town, and so they are utilizing video conferencing to reach out to patients. And then as well, e-health innovations, whether this be through smartphone apps, or just like Kevin had mentioned with his research, where they use a personal health record to try to improve diabetes outcomes. So getting into how to get professionally involved, first and foremost, you can join the section of Pharmacy Informatics and Technology within ASHP. There's also, the journal has an informatics interchange column as well, and there are a lot of people submitting their ideas and their new projects, and so you can see what's currently going on in the pharmacy informatics world. And then as well, during the ASHP summer meeting in June every year, one of the sub-meetings is actually the Informatics Institute. As well, you can join the American Medical Informatics Association. I will say that because this is the American Medical Informatics Association, it was primarily led by physicians. There's also a lot of prominence in nursing informatics as well, but there is a working group for pharmacy called Pharmacoinformatics. And you can see what kind of projects and initiatives they're working on at that link. And then as well, there is also the Pharmacy Health Information Technology Collaborative, and there's a lot of projects going on there. And I think Brent had mentioned this as well, and you can see what is currently going on and what are current problems in the pharmacy informatics world. As well, locally, you can join your graduate informatics organizations. This might not be a pharmacy organization, so you might have to go to the actual graduate page and do a little bit of research of what the current graduate students are doing in informatics. And then as well, just join your state or the National ASHP Health Systems Board as well. And they're a lot of times talking about how they can utilize new technologies in their practice. So I'll talk about dual degree opportunities. To my knowledge, there aren't many out there. I'm aware of maybe one or two. But if you can, just because there isn't an official dual degree program in your pharmacy school doesn't mean that you can either start one or at least try to have an informal dual degree program. So this might mean master's degrees, or as well you could do graduate certificates that at least the University of Iowa has available for both graduate and professional students. You can also do academic concentrations, or just simply take some classes. Take some classes that are related to informatics or computer science just to get some firsthand exposure of what that's like. So I would definitely encourage everyone to look outside of your pharmacy school, because a lot of times informatics hasn't reached the pharmacy school level yet. A lot of times medical or nursing schools have already implemented some kind of informatics track for their students. And then, so you might actually have to go to the graduate informatics or computer science departments to look at what opportunities are available to you. And like I said before, just because there isn't a formal dual degree program established doesn't mean you can't start one. So this is something that I was looking into my P1 year. And so the first thing I did was talk to my pharmacy advisor. And then as well, since I did take some informatics classes during my undergraduate, I was in touch with some of the computer science and informatics department advisors, and I talked to them as well. So this would mean sitting down with the program director of those programs and talking about what kind of barriers or concerns they have in creating a dual degree program. I would definitely say that you have to establish buy-in with key stakeholders, which would mean current pharmacy leaders and in administration as well, so that you as a student aren't just trying to make your argument. As well, you have the buy-in from your dean of the pharmacy college, or you have, for instance, pharmacy managers at the local health systems institution, excuse me, to help out supporting your cause and supporting your argument that there should be some kind of dual degree program. I would also warn you to be very flexible. Be ready to be very flexible with your 4-year course, which might mean taking night classes, which might mean, talking. For instance, for me, I had to talk to my advisor to specifically say, hey, can I make sure that I have this lab on Friday mornings because I want to take this class that's every Monday, Wednesday, and Friday afternoons. It's little things like that with the schedule that can really, really affect how one class, which might be a prerequisite to another class, and it might hold you back in graduating on time. And then as well, this might also mean loading up on summer classes. I do remember one summer I was taking 4 classes and it was very busy, but I ended up really appreciating doing that and thanking myself later, because then I was able to graduate a semester early. And then as well, I would encourage taking advantage of your current introductory pharmacy practice experience, and as well your advanced pharmacy practice experiences. So this might mean during your first year, second year pharmacy school, look at creating out-of-system IPPEs, or at least at places that have a strong informatics component, so that maybe one day you could talk to your preceptor and say, hey, I have an interest in informatics, can I shadow the current pharmacy informatics specialist for a day, which I was able to do at multiple places, just even for one day. This might also mean working with the director of your professional experience program about adding any electives or creating other out-of-system APPEs as well that can at least incorporate informatics, or create a new rotation for yourself when you start. And then I would definitely try to schedule your APP rotations, whether that be related to pharmacy or not, but at least at larger institutions, or at least institutions that have very well established pharmacy informatics departments, or as well maybe there's a certain researcher that is doing a lot of pharmacy informatics research and you can establish a rotation there as well. So with that, I'll wrap up with our contact information. If you have any questions or comments or would just like to contact any of us, here's our contact information. And thank you for joining our webinar. I really hope that this identified some opportunities for students, and as well as identifying how pharmacy informatics is incorporated in the academia field.